All right, well, it's 12 o'clock. So why don't we go again and get started since we have so much to unpack in 30 minutes. So I'd like to welcome everyone to Wellness Wednesdays. This is a special series that's produced by the Society for Integrative Oncology. My name is Leigh Leibel, and I am the chair of the Yoga Special Interest Group for the Society for Integrative Oncology. And I work at Columbia University Medical Center in New York. I have a mind-body practice working with cancer patients at all stages of care. So the purpose of these Wellness Wednesdays is to introduce you to the breadth and diversity of evidence-based or evidence-informed practices that can help reduce stress, reduce anxiety, and cultivate compassion and resilience. What these practices also teach us is how to be open and more fully present. And these skills are so important as we gather as a nation to talk about racism and to talk about the effect that it has on our public healthcare systems and our private healthcare systems. So today's topic is minding the gap. Disparity in cancer care and how we can use yoga as in advocacy and community building. So I'm really excited to introduce two wonderful women today who are making a tremendous difference in people's lives in the clinic and in the community. So Dr. Eleanor Walker, thank you so much for joining us. Dr. Walker is a senior staff physician at the Henry Ford Cancer Institute in Detroit, Michigan. She is the director of integrative medicine and for the entire Henry Ford healthcare system. And she's also the head of the breast service for radiation oncology. Dr. Walker her clinical interest is breast cancer, prostate cancer, minority populations, and integrative medicine. So Dr. Walker is dedicated to treating the entire person, not just the person's disease. Dr. Walker is also very involved with the Society for Integrative Oncology. She has served on the Board of Trustees and a couple of weeks ago was re-elected for another term. So I welcome you, Dr. Walker. Thank you so much for joining us today.
Thank you, Leigh. I appreciate it, and everybody for inviting me to participate. Now, as I warned Leigh, I tend to talk a lot, so I'm going to try to keep my part to this in a timely manner, so I'm actually going to time myself here.
Well, hold on. First, let me introduce our other panelists, and then I'll come back to you. So I want to send a warm welcome to Marsha Banks-Harold. Ms. Banks-Harold is a certified yoga therapist, and she is a trauma-sensitive yoga facilitator. She works with cancer patients and also with clients who have been impacted by trauma and microaggression. She is the founder and owner of Pi's Yoga Studio, Fitness Yoga Studio in Alexandria, Virginia. And Pi's stands for physical, intellectual, emotional, and spiritual. She's the creator of a flagship yoga program called My Body Don't Bend That Way. And it's a really beautiful, beautiful practice. And in fact, Ms. Banks-Harold has pre-recorded a 20-minute video on this, My Body Don't Bend This Way. And it's been uploaded to the SIO YouTube channel. So please, at your leisure, hop over there and practice with Ms. Banks-Harold. She is also an electrical engineer, and and she's an officer in her church. Ms. Banks-Harold is also a member of the Yoga Special Interest Group, and she is the chair of the newly created initiative on diversity in yoga therapy and cancer care. And under Marsha's leadership, we hope to really impact the cancer journey for Black people, for Indigenous people, and for people of color, and also amplify the voice of all underrepresented cancer patients and survivors and their families. So a warm welcome to you, Ms. Banks-Harold, for joining us today.
Thank you, Leigh.
Yeah, okay. So Dr. Walker, back to you. You know, the statistics are staggering. The American Cancer Society says that a Black woman with breast cancer has a 40% greater chance of dying from breast cancer than a white woman.
You know, it wasn't always like that. I think there are many things that have happened that occurred. So in the 80s, when we first started doing mammograms, that is when we started seeing a divergence. So white women tended, because of also the population, tended to be the person who had more breast cancer. Then when the incident rates, when we were diagnosing more white women, seemed to get treatment earlier, and they weren't left out. So just to even talk about some of the stats, we know that women make up the majority of our US population, correct? And that minority populations, whether it's Latino, African Americans, are projected to be 35% of our population by 2040. And our population is aging. So by the year 2040, women will make up the majority, women over 85 actually, will make up the majority of the population in the world. So until 2015, that's when African-American women actually had lower incidence of breast cancer, but always, unfortunately, a higher mortality rate. Triple negative breast cancer, which is breast cancer that does not grow in the presence of the female hormones, estrogen, progesterone, nor does it express the HER2 protein, which can be a marker of a more aggressive tumor, has been found more commonly in African American women. And we know because of the Middle Passage, the movement of slaves from Western Africa, where you see there is a higher rate, almost 40% of women and 6% of men, Black men in Western Africa, have this triple negative breast cancer. Whereas if you look at Eastern Africa, like Ethiopia, the incidence is closer to that of triple negative breast cancer in Caucasian women in this country. So right there, we saw this disparity that started. And this type of breast cancer is very aggressive with a decreased overall survival. So a lot of studies are going on in this type of breast cancer. And African-American breast cancer patients have more cancer recurrence and progression. But breast cancer is not the only area where we're seeing these disparities. There's racial disparities in colorectal cancer death rate, which we feel may be explained by differences in the use. Nobody wants to get that colonoscopy when you hit 50. And also having it available in your community and being comfortable with your physician that you're seeing to have this done. And as we know, prostate cancer is another area where there's disparity in this country. Prostate cancer is very low in Africa, but African-American men in the United States have the highest risk of prostate cancer and a 2.4 times higher mortality than Caucasian men. So we feel the reason for this disparity is a mixture of environmental, genetics, and lifestyle, okay? So why the disparity? Well, African Americans may have exposure to key risk factors and a higher burden of comorbid disease. There's been the social determinants of health, where we look at African Americans in this country who, as we can see with COVID too, who are doing the jobs where there's greater exposure. The pressures of being African American in this country, as you see what's going on with young Black men and women being killed right in front of us. And this has been going on a long time. It's just the cell phones are now letting the rest of the country see it. But all of this stress leads to comorbidities. African American women who have healthcare, who are educated and have prenatal care, they have worse birth outcomes. So it's across the board. Also, in cancer care, African Americans have lower access in some places. And like at Henry Ford Hospital, we've done a study looking at prostate cancer, equal numbers of African American and Caucasian men with prostate cancer. And we were able to show that if you have equal access, equal treatment, our patients are all presented in our multidisciplinary tumor boards and clinics, the outcomes can be the same. So if you can make sure that everybody has health equity, okay, it doesn't mean that you're giving each person the same thing. You're giving each person what they need to have the same outcomes. And so it's important to take care of the whole body. We have to educate the patient. We have to educate the doctors, the healthcare providers. We have to let them know how stress impacts your health. Okay, we know how common hypertension is in African Americans too. What are the things we can help other African Americans do to decrease their stress, like what Ms. Banks-Harold is doing with her yoga? The trauma of growing up Black in America also contributes to this. So there are biological factors, as I talked about, the genetics of coming from sub-Saharan Africa, the more aggressive types of prostate cancer we see in Black men, their families, and there are some genes that are being studied, and particularly the Duffy gene. One of my co-investigators, Dr. Lisa Newman and Dr. Melissa Davis, that we're working on our International Breast Cancer Subtypes group, looking at that effect and the modulation of inflammatory markers in cancer that are different in African Americans because of this gene and what has happened to it through the African diaspora. So there's a lot of information out there and things that we can do. And then people, because of the lack of education, like sometimes women, Black women are more likely, 48% more likely to omit radiation when it is indicated for their breast cancer treatment because of fear and not seeing a doctor that looks like that. Just before I came here, I just saw a woman, a breast cancer, a Black woman. She has bilateral breast cancer, and she looked at me in shock and said, "Wow, I didn't know you were Black. I'm happy to have a Black doctor here." So that's some of the things that automatically seeing other people that look like you helps Indian people, Black people, Hispanic people feel more comfortable about getting treatments that are recommended for them and let more trust in their doctor than the lack of trust because of the things that have been done in the past. So I don't know how I'm doing on time, Leigh.
You've got a couple more minutes. You're doing a great job.
Good. So one of the other areas I didn't talk about is lung cancer. There's a disparity in lung cancer also with African Americans. Your race didn't impact survival, but Black people were less likely who had an indication for surgery for their lung cancer, meaning that they were actually screened and found earlier. They were less likely to get surgery than a white person in the United States. Also, we know when it comes to pain, a lot of our cancer patients may have pain, and sometimes it's ignored. Sometimes, oh, it's not that bad. Whereas if a white woman or man presented to the doctor with the same amount of pain, more studies would be done, and there would be less of a disbelief in the amount of pain they're having. So there are many things. And even in radiation, if you got definitive treatment, you were able to have equal results. But if you did not get the definitive treatment as recommended by your doctor, then there is a disparity. So we have to do, in order to address these things, I think there are multiple interventions that need to be done. As I said, there's got to be equity. So we have to actually make education available within the community, educating the healthcare providers on how to approach patients, to be culturally sensitive, to realize that sometimes it's not that the patient doesn't want to do something, or it's that they don't understand. It hasn't been explained in a way that they can follow. And we have to be better at helping our patients to understand and to make good choices. Work with our community workers to help our patients understand, get them in for treatment. I'm happy to say that because Henry Ford is in an urban area, there are so many African Americans now taking advantage of our yoga, our acupuncture, our massage therapy, mind body, Reiki. And this is not common. In New York City, it's more common, but it's still not as common as it should be. So these are just some of the thoughts that I have about addressing this. And we know, like, Dr. Lewis Sullivan several years ago wrote a report on missing persons, minorities in health professions, and we have to increase the pipeline. There are not enough people who look like me that are out there, or look like Miss Banks-Harold, who are helping patients who are experiencing disparities in their care, their health care in general. So we have to do a better job of bringing in the pipeline and educating people in this country. So I'll end here if there are any questions.
Do you want to, why don't we hold questions until the end? We'll have Ms. Banks-Harold talk, and then we'll open up, because I'm sure there are lots of questions there. Thank you, Dr. Walker. That's, I mean, I think that a lot of people, we really need to talk about social determinants when we talk about disparity in healthcare, and how zip code really affects your ability to get healthcare or access it. And I think I'm going to throw this over to Ms. Banks-Harold now, but I'm just going to set this up a little bit and talk about sort of how yoga comes into it. I mean, it comes into it in so many different ways, but I think that people probably don't know that the Reverend Dr. Martin Luther King traveled to India in the late 1950s and met with Mahatma Gandhi. And so much of his, Dr. King's philosophy on social justice and nonviolence came from India, and came from these Vedantic theories of nonviolence, ahimsa, which is the foundation of yoga, satya, which is truth, which is one of the foundations of yoga, and svadhyaya, which is self-reflection and self-study. So I think that just sort of beautifully sets it up. I'm going to toss it to Ms. Banks-Harold, and she'll talk a little bit about how she is taking yoga into the community and its trauma sensitive and culturally sensitive practices. So Ms. Banks-Harold?
Yes, thank you so much for having me today. And thank you both Dr. Walker and Leigh for this opportunity. You guys are exactly right. The disparities that Dr. King talked about, as well as Dr. Walker, in regards to the number of women of color, Black women that are dying at a higher rate, and also men with prostate cancer that are dying at a higher rate, are prevalent as well in the yoga community. As a yoga therapist and a trauma sensitive yoga facilitator, I see clients in my yoga studios that are in desperate need of the benefits of yoga and yoga therapy. Unfortunately, the places that I provide yoga therapy to, there are not a lot of people of color or Black people that are gaining access to this wonderful treatment called yoga and yoga therapy. In order for me to make sure that people that look like me have access to this, I'm able to go into the communities. I go into community centers where there are programs like the Crunch Bunch in Alexandria, Virginia, where the population there is 99% people of color, Black people that have a whole lot of different medical conditions that yoga can benefit. There are also a lot of clients with cancer. Unfortunately, when I work in clinical settings like hospitals, I've been teaching for over a year, and I see about 300 visits of participants of people who have various types of cancer. In the whole year that I've been teaching, I've seen one Black woman and one Black man. That really brings us to the opportunity to bring about change in the yoga world. I wish that it was only an issue in the clinical setting. When we look at yoga as a whole, based on the survey, 85% of people that take advantage of yoga, 85% have identified themselves as being white. And then in 2012, it was 3% only of people of color, Black people, that were practicing yoga. Now we've seen an increase in the last 4 months. There's data that shows it's up to 5% now, but still that's a huge disparity. And like Dr. King pointed out, when you have inequality and injustice in the healthcare position in this field, then people are not being able to gain access to the wonderful benefits of yoga and yoga therapy, like stress reduction, like Dr. Walker talked about. Racial trauma is real. We have people that are really having to deal with seeing communities of people being killed on the streets. We're having people of color that are not being able to have access to education the same way that other people are. So this is really an opportunity where yoga and yoga therapy is a well-known tool that will allow people to really shift the stress, to mitigate the trauma that's associated with being Black in America. And also, because of the trauma aspect, being a cancer survivor, the stress is inherently there. Once the diagnosis comes, my parents, and who are survivors as well, and my patients report to me that they automatically feel disconnected from the community. They automatically feel that they're othered. And so yoga therapy in itself is based on this concept of self-study, as Leigh has pointed out. So this is an opportunity for us to really look at ourselves internally, to look at the authenticity of the work that we're doing, to see, are we building relationships with people that can benefit from this practice? As a Black community, we're very relational. So that means we have to take the time to understand, who are you teaching? This is an opportunity as doctors and as yoga teachers and yoga therapists to get to know the person that is before you. When I've entered into numerous yoga studios in this world, there hasn't been always a welcoming and inclusive environment. And so that's why I had to create my own yoga studio. I also had to get to the point where I can certify yoga teachers and yoga therapists. We have to increase that pipeline, as Dr. Walker talked about. We have to increase the number of yoga teachers that are present, yoga teachers of color, Black yoga teachers, the number of yoga studio owners, the number of directors of yoga teacher training programs and yoga therapy training programs. I sit before you as one person that represents all of those categories, but that's not enough. We really need to come together as a community to build relationships, to provide support. So this is literally a call to action for self-study. Let's look at the yoga world, look at the yoga therapy communities, and see, how can we bring about change in such an important time as this? How can we support communities that really can benefit, so that we can reduce that 40% of Black women who are dying at a greater rate than other white women that are equivalent to them? How can we reduce the number of Black men that are dying at twice the rate of white men? The answer is here. We have yoga. We have yoga therapy. If we increase the number of yoga teachers, yoga therapists, then we will be able to go out into the communities. As Dr. Walker pointed out, people want to see people that look like them. I'm constantly called by women and men that are interested in becoming yoga teachers and yoga therapists. They're like, I've never seen a Black yoga teacher and a Black yoga therapist. I had someone from Barcelona who contacted me, and she said, I just wanted to Zoom with you so I could see that you are real. And now she wants to be a part of my training program. And so this is something that we as a yoga community and as a yoga therapy community can make immediate change in, if we provide the financial support to ensure that the teachers are able to gain the quality education that's needed to be an outstanding yoga teacher and a yoga therapist. We also need to take yoga to the communities of where people are located. We have to meet people where they are. So this is an opportunity to show up in places that maybe may not be the place that typical yoga studios are held. We also have to make this affordable. And when cost is a factor, we need people to donate so that we can make yoga accessible for people that may not have the financial means. So this is really an opportunity, a call to action, to build relationships, to have self-study from all parties that are involved, to increase our resiliency, because this is not an easy journey, being a cancer survivor or being an advocate for people that are not heard or seen. And finally, to exhibit compassion, compassion to ourselves, compassion to those that are in need, that can benefit from this amazing practice called yoga and yoga therapy. So like Dr. Walker, I call upon each of us to look at ourselves, to look at our lives, to do our self-study, to rely upon our breathing techniques, our meditative aspects, and the ability to simply meet people where they are. It has really been a pleasure to speak with you, and I look forward to any questions that you may have. Thank you for having me here today. Namaste.
Wow, that was amazing. Thank you, really. Thank you so much. I think as a white woman, one of the things that we wanted to achieve with our 30 minutes today was really not to just rehash these staggering statistics, but really, as Ms. Banks-Harold said, this is a call to action. This is the beginning of the conversation. As a white woman, I can use yoga to take that moment to pause and turn inward for my self-study. I can be quiet. I can listen. I can develop empathy. I can begin to understand what institutional racism means. And I want to just quickly say that there's another civil rights leader named Howard Thurman, who was a mentor of Dr. King's. And he said, let us all look at the world through soft eyes. And yoga can really help us to soften, to engage the parasympathetic nervous system, to relax, and to look at the world through soft eyes. And it teaches us that we are interconnected. So let's open for some questions. If anybody wants to, there are no questions in the chat box, but
may I ask a question, please? This is Jodi
yes.
MacLeod. Thank you, both of you. I was wondering, during this pandemic, when online yoga has been, I know for myself, a lifeline, has there been an increased uptake with online classes with minority participants?
Thank you for the question. Unfortunately, the answer is no. A lot of my clients don't have the financial means to have a computer or a cell phone or internet access in order to gain access. So unfortunately, that is still an issue in regards to disparity. A lot of people, most people have cell phones or computers, but a lot of my clients in the aging population, the special needs population, and yes, so the communities that I serve in my studio, this has really harmed the attendants because they don't have the financial means or a quiet home or space or an additional space to lay out a yoga mat. So unfortunately, I've not been able to connect with as many people that I was seeing before because they don't have the means to connect with my studio via Zoom.
And I would say, because most of the yoga classes in the Henry Ford Health System were group classes, you know, the Detroit area was, and continues, not as bad as some other areas right now, but we were right behind New York and New Jersey in incidence and death rates initially in the beginning of March. So the system-wide, we made a decision about closing our multiple sites, not just for integrative medicine, but in general. We have 2. By next week, we'll have 3 of our sites reopen. So we're slowly bringing people in, but doing the group classes has been difficult. We're only doing individuals. And as I said, we did have meditation online for our patients to try and help, but I can't say that many people took us up on the offer. You know, I'd say more of the healthcare workers did than the patients.
And I'll follow up. In the clinical setting, the non-people of color, non-Black people, yes, those numbers have increased. So usually I have 7 people in my yoga therapy sessions, and now it's like 20 to 25. So I have seen an increase overall, but not in the Black community. So that I wanted to differentiate that for us.
Yeah, wow. More questions? Jump in.
So I have one. I'm a white presenting, actually mixed race person, but obviously you can see quite white presenting. I'm very active in anti-racism and social justice in my community. And I would love to bring the yoga, the meditation to this work, but I hesitate to because of all the issues you've presented. I'm wondering if if you have, or you're planning to as part of the subcommittee, and I'd love to join that subcommittee, develop a training for those of us who do look different and who aren't as affected when we're out in society, to be sensitive, to be understanding, to feel it. I mean, even with all the work I've done, foot still goes in the mouth enough times. And I'd love to be able to talk or to work with yoga therapists, people who understand yoga and the issues.
Yes, definitely. That's an excellent question. In fact, I have created a training program that I've used within my studio. I'm now expanding that to allow it to be used outside of just my studio. But yes, the answer is that we have to expand that in order to be able to reach a lot more people. And so one, thank you for all the work that you've already done. And I would love to be able to chat with you more. I've been working with one candidate, a PhD candidate in social work, and we've developed a training program around racial trauma and the integration of psychotherapy with yoga therapy from the trauma perspective. And so we're in the early stages of actually making that available to the public. We've piloted it within my studio here in Alexandria, Virginia, but now the beauty of Zoom and is to be able to reach other communities. So absolutely, part of my vision is to have a training where we can have training for everyone, because when we can connect together, that interconnectedness is more powerful than just a small group of people. So thank you for the question, and yes, that is a part of my vision.
That's wonderful. I'm very excited about that. I mean, I don't have locally another African-American yoga teacher to connect with, to maybe do something joint.
Me.
Yeah. Okay. I will.
Chat.
We'll chat. Thank you.
You're welcome.
That was a great question, Doreen. Thank you. Anybody else? We have time for maybe another.
I would like to say something. Hi, you're having trouble seeing me, but my name is Teri Richardson, and I'm in Brooklyn, and I have a yoga studio in Brooklyn, and I teach Y4C classes. I work with Tari Prinster and Josie over at Y4C, and they're on today also. And so our classes, I'm in Park Slope, Brooklyn, which is a very white community. It was very ethnically mixed before, gentrification kind of took over. So there's sprinklings. But in our Y4C classes, we'll say, I don't know, when the class is, say, full at like 18, we actually may have maybe 6 or 7 people of color in class. And that's pretty much our average, but it is definitely more white than ethnically mixed. But, I find that in the studio, anyway, in regular classes and in wanting to, you know, have more people of color. I think same as Marsha, not really knowing where or how. I mean, it sounds ridiculous, but where to sort of find other people of color when you're a person of color. But that's a very real thing that we work with all the time.
Most definitely. This is not a new experience. You know, I'm an electrical engineer, so I was one of many. I was the only Black person in a lot of situations in life. And so I've worked closely with a lot of agencies to increase the number of Blacks and minorities in engineering. So I bring that same skill set into the yoga world. And that's part of my vision, is to bring the skills that I used in the science and technology world into the yoga world. There are tons of us out there. You know, there's the Black Yoga Teachers Association. There are a lot of Black yoga teachers, but we need to collect ourselves together so that we can make an impact and also increase the number of participants that, as Dr. Walker pointed out, in terms of education, we have to educate the Black community about what yoga actually is. What is yoga therapy? And once we do that, people will be more likely. It's not going to look like a typical yoga class. We have to meet our people where they are. There's going to be dancing and a little bit of fun music. And then once people feel comfortable, once they build that agency where they feel confident and safe, then people will be able to go out into the community and see the benefits of this yoga and yoga therapy world all over. Excellent point. And go ahead, Dr. Walker.
I just want to make, I just want to make a comment. I'm agreeing with you there. One of the things I know that my Pilates yoga teacher here said to me, that as she was working with some of our African-American patients here in the cancer center and in the churches, because of religious reasons, sometimes people don't want to deal with yoga. And instead, she says, she just tells them when you're talking about that quiet time, think of prayer. It's the same thing. And we talk about it all the time, how to approach. I'm from Brooklyn, and yes, Park Slope used to be Black when I was growing up, okay? So and it is very ethnically diverse now. And that's happening with the gentrification of Brooklyn in any case. Well, the whole city practically. But I think I don't know how much you guys are getting out there. As I spoke with Ms. Banks-Harold yesterday about, I had heard about a Black male yoga studio down there off of Atlantic Avenue. And he brought in a lot of men with trauma. So I think it's kind of, you're going to have to get out there and work through the different community groups and the different churches, to educate people, because I think that's the first step in getting more Black people to participate in yoga.
Thank you. I hate to come to the end of this fantastic conversation. There are a number of questions in the chat box. You know what we'll do? We will, I'll huddle with our two speakers today. We'll answer the questions and then we'll send you an email. Also, some people have asked for resources, so we'll include that in an email follow-up to you. I'd like to thank all the participants, everyone who showed up to the community table to begin this important conversation. I especially want to thank Ms. Banks-Harold. You are awesome. And Dr. Walker, you are awesome. And again, I hope that we can all, everyone on this call today, can lean forward with an open heart and begin to look at injustice and fighting injustice in our own communities. And then that will ripple out into our world. So thank you everyone for coming. Have a wonderful, wonderful day.
Thank you too, Leigh, for organizing this, and SIO.
Yes.
Yeah.
Yes, thank you, SIO. Thank you, Leigh. Thank you, Dr. Walker. Thank you to all the participants. Thank you. Go in peace.
Namaste.
Yeah.
Namaste.
Yeah.
Namaste. Namaste.
Bye.